Chronic kidney disease is a very common problem in the United States, affecting some 26 million Americans. Although anyone can develop kidney disease, certain groups of people are more at risk, such as people over the age of 60, African Americans, Latinos, Asian Pacific Islanders. Here with us today to discuss the risk factors, the awareness problems, and the prevention problems is Dara Darguste, Clinical Coordinator for the Mount Sinai Center's Chronic Kidney Disease Program. It's a pleasure having you on the program.
Thank you for having me.
Let's start from the beginning so that people understand at home what is chronic kidney disease as opposed to just kidney disease.
Well, kidney disease is usually the general term. Chronic kidney disease is just a long-term version of it. What kidney disease is, it encompasses many conditions that affect the kidneys and cause damage to it. So that means that the kidneys are not doing its proper functions, which is eliminating waste, controlling body fluids, controlling sodium, phosphorus, potassium, things like that that the body needs. It's not getting rid of the waste from whatever you're taking in terms of medications or foods or
So when you
beverages.
have a kidney disease, your kidney is simply not working right?
No, it's not working right.
Okay, and what are some of the common causes? What happens?
Well, there are many causes. You could have a family history of chronic kidney disease. You could have
So it's hereditary?
It could be hereditary.
Okay.
That's something, it could, but you could have polycystic kidney disease, which could be hereditary. You could have HIV, AIDS, autoimmune disease has an effect on kidneys as well. But the two main causes really for chronic kidney disease, the most popular ones, are diabetes and hypertension. So what happens is when you have diabetes and it's uncontrolled, which means that you're not monitoring it properly, you have spikes of sugar levels and things like that. It causes a lot of damage to the organs, especially the kidneys, and also the same thing with hypertension. However, with hypertension, the thing about the kidneys is that the kidneys, hypertension affects the kidneys, and your CKD, chronic kidney disease, could affect your blood pressure as well.
So what are the symptoms? How do you realize that there might be something wrong with your kidneys?
Well, the problem is that there are no real symptoms in the sense where there's nothing that you could pinpoint and say, oh, I have chronic kidney disease. Usually the symptoms that you have were usually towards the later stages of chronic kidney disease, and most of them are run-of-the-mill. So it could be excess urination at night, frequent urination at night. You could have dry, itchy skin, problems concentrating, things like that. But the more severe symptoms, you would have it usually at the point where you do need dialysis, and that would be shortness of breath, or swelling, facial swelling due to volume overload.
So what determines, how do doctors know that you indeed have a disease?
Well, the way to get tested is actually to get a blood test and a urine test. What they're going to test for is creatinine and protein in your urine, which technically shouldn't be there, usually because it's too big of a molecule to pass through. So if you have a lot of protein in the urine, that's a sign that there's damage to the kidneys. Through the blood test, what they're looking at is creatinine, and that's something that usually your body is filtered out through the body. So a high rate is an indication that there's problems with your kidneys.
So how can we prevent it?
Well, there's no real way to prevent it. You just have to constantly keep track of your health. If you have diabetes or hypertension, you constantly want to see a doctor and make sure that it's properly monitored. You want to just, if you're diabetic, you want to make sure you test your blood sugar, take your medications, don't let it spike too much. But it's really just controlling those things. However,
what about if you're not a diabetic and you're not suffering from any of these signs just yet, but you want to take care of your health in terms of like you want to protect your kidney? Is there something
the best way to do it is just to get tested. Get tested once a year at least. Have your blood test drawn, your urine test. Have that done frequently.
So
that
early signs can be detected by having a yearly checkup?
Just like with any disease. If you catch it in the early stages, you could slow down the process. Unfortunately, kidney disease is not a disease that's reversible, but you can slow down the process. And by catching it at an early stage, you're better off.
Okay, and once you catch it, what should someone do?
The minute that you know that you have chronic kidney disease, the best thing to do is to educate yourself, find out what causes it, what you can do to slow down the progression. See a nephrologist, which is a kidney specialist, on a regular basis. Your nephrologist will let you know how often you need to see them.
And once you see these people, what are the options they give you, though? What do they say? Okay, what dialysis, is that an option?
No, well, dialysis would be an option in the later stages if you do have chronic kidney disease, stage 5, which means that your kidneys effectively are not working at all.
Okay.
So the thing is that you want to make sure that you if whatever the doctor says is necessary, depending on what your health status is. If you do have any kind of illnesses, you want to make sure that you see the doctor, and they'll tell you if you need to adjust your diet, if you need to take in more fluids. They need to find out what's causing it.
So you don't really need dialysis unless your disease is very advanced?
Yes.
Okay,
dialysis is really what we also refer to as kidney replacement therapy.
Please explain what dialysis is, really.
So what dialysis is just it's a treatment that does what your kidneys normally would do on a 24/7-day basis. So what happens is if you have chronic kidney disease and your kidneys are not working, you have that buildup of extra fluid and toxins in your body, which could be extremely dangerous. Could even go as far as stopping your heart in terms of phosphorus. So the best thing to do is actually to just, if you're getting dialysis, what it does is it cleans your blood. So,
but basically you're tying yourself up to a machine that's going to act as your kidney for a little while.
Yeah, well, there are two forms of dialysis. There's hemodialysis, which deals directly with the blood, in which if you go to a center, you would go 3 times a week for about 3 to 4 hours at a time, and you would have to sit in a chair, and there's a dialysis machine about this high. It has a filter attached, and you would it would hook up to Vascular Access, which I would explain in a little bit. But it would essentially, a little bit of blood is taken out, about 2 cups of blood is out of your body at any given time. It's passing through the filter, and all the toxins are being removed, and the clean blood is being returned back to your body.
So it's your own blood that's coming back in?
Yes, it's your own blood, cleaned. So you would do it every other day, either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday.
So are there options? Is transplant an option?
Transplant is also another option. If you have a living related donor, who's somebody who's willing to donate a kidney, or a family friend who is a match, then the wait shouldn't be very long. However, in New York State alone, the wait could be up to 7 years if you don't have a living related donor.
And the donor, what kind of risk is he under, or she under?
They're at risk too, which is why we go through rigorous steps to make sure that not only the person who's going to receive the kidney is in proper health to actually take on the process, but to make sure that the person who's donating the kidney is also safe.
You mentioned that you were going to mention later this process of
Vascular access.
Vascular access.
Vascular access.
What is that?
Well, vascular access deals primarily with hemodialysis, and it's a way for you to get to the blood. Your veins are not strong enough to undergo dialysis, which is the removal of blood and putting back of blood. It can't handle it, so you need a way to actually get to the blood. There are 3 forms. There's a catheter. A catheter is usually a plastic tube that they would use. It's usually put through the chest, and that's a way to get dialysis. It's usually meant for emergency or temporary use only, so that means somebody whose kidneys are not functioning at all, and the person is at risk of dying, like relatively. So either they're volume overloaded, or they have too many toxins in their body, so they're in danger of having a heart attack. So you would use a catheter. However, that's not the best method, because the longer you do have a catheter, the higher chances are of developing an infection, which could be fatal if it's not properly.
So when you're going through all this treatment, there are possibilities of catching another disease?
Not necessarily another disease, an infection.
An infection is what I mean, yes.
Yeah, definitely. However, with a more permanent access, like fistula, which is when they combine one part of the vein and another part of the artery in one location. It's usually in the forearm, the upper arm, or the thigh, which thigh is usually the last resort. But it requires minimally invasive surgery. They would do the surgery. A vascular surgeon would do the surgery, and after about 2 weeks, you would go see the vascular surgeon again, make sure that everything is working, and then eventually, with time, you need to let the fistula mature, and it can't be used immediately. So with exercise and monitoring, you'll just make sure that the fistula is ready to be used. And once the fistula is ready to be used, then you could use it. The good thing about a fistula, it's your own body. It can last up to 10 years or more if it's really well taken care of. There are fewer chances of complications and infections. also because it's underneath the arm and there's nothing foreign in there. And it also gives you better dialysis. You have more of a blood flow through a fistula than if you had a catheter or something.
But regardless, you still have to go in 3 times a week and sit there for several hours.
Yes, you do.
Okay.
And the other option is the AV graft, which requires...
So do you feel that what we're doing here is enough, or should there be more publicity to this issue? I mean, this is why you're here, to explain to folks, expose this issue to people. Is there enough being done?
There's a lot being done, but there's always room for improvement in terms of awareness. The problem is that most people who do come into our dialysis centers usually found out that they had dialysis when they're already in the later stages. And that's a huge problem. It's due to, not going to the doctor frequently. It could be, that they didn't go to the doctor until they were actually feeling physical symptoms. So that's a huge problem. And not knowing. And also
in this
not
day and age, it's hard to believe that people wait so long when they talk so much about preventive medicine.
Oh, definitely.
Go for your annual checkup and all that. And then you find out that there's people showing up with an advanced disease already and checking up. Is that really that common?
Well, it's very common, especially because you have that fear of the doctor. You also have people who have mistrust of the healthcare field. So it's a lot of factors that play in, and so it's really important. A lot of people don't even know what chronic kidney disease is. Most people feel that if they're able to urinate, their kidneys are working fine. But unfortunately, that's not an indication that your kidneys are in proper shape.
So what does Mount Sinai do to raise awareness?
Well, what we do is we have free screenings in the neighborhood and at various locations. We give people the opportunity to actually get screened, which means that we have free testing, blood and urine samples, and then we let them know if they do have chronic kidney disease or if they're in proper health. And then we also encourage them, we let them know what chronic kidney disease is and how at risk they are, because unfortunately, most people, as you mentioned earlier, that are affected by chronic kidney disease are African Americans, Asian Pacific Islanders, Latinos, and people over the age of 60.
Why? Why these particular ethnic groups?
Those particular ethnic groups, because we have a propensity to have hypertension, diabetes.
Could it be with the food that we eat as well?
It could be.
Diet?
The diet and things like that.
Okay, I understand that you also host some fairs, so public awareness fairs.
We do public awareness fairs, which is what I was mentioning before. We talk to people, and we explain to them what chronic kidney disease is. We offer the screening free of charge, because sometimes that is a barrier to actually getting tested.
Yes, of course.
And then by letting them know ahead of time whether or not they have chronic kidney disease, hopefully in hopes that we could catch it early and delay that progression.
And for you, as a professional working in this field, is it gratifying to see that you're helping people?
It's gratifying, but at the same time, it's sad because I work with patients on dialysis as well. So my goal is more towards the preventative side. I want to see if we could catch people early, let them know what they can do to prevent that progression to the point where they do need dialysis. And even if they do need dialysis, letting them know ahead of time, that kind of delays the shock and helps them make more informed decisions and helps them be more proactive in their health.
How many people go through your program a year?
Oh, I haven't really counted. Hundreds.
Really?
Yeah, because we deal with the inpatient side as well as the outpatient side. So people will just come in and, and they'll come in for something, and then that's how they find out they have chronic kidney disease.
There's no cure?
No, there's no cure yet. There's no cure yet.
And is there any concern on behalf of medical workers, such as yourself, about getting stabbed with a needle, getting some kind of illness because of dealing with especially with dialysis patients?
Well, the thing is that that it's just common practice. If you're dealing with any kind of blood or blood draws or direct patient contact, you're always going to have those risks. So it's nothing more than run-of-the-mill. So if you're already doing that patient care and you have that, you already know what you need to do to make sure that you take care of yourself and you protect yourself and you protect the patient. And then on top of that, if something does happen, you know what to do. There are certain practices and procedures that are already in place to make sure that the patient care provider is in good health as well and stays healthy.
We really appreciate you having been here. It's been very, very informational, good information for the folks at home. How do people get a hold of the center? Is there a number where people can reach for more information?
If they have any questions or if they would like to find out about screenings, they could always call 212-241 4060.
Okay,
Okay.
great. Thank you,
Thank
Dara.
you
It's a
very
pleasure
much.
having you on the program.
All right. Thank you.